White House is currently having a live news conference regarding the coronavirus task force. We're not taking it live because, frankly, Donald Trump has been prone to lie consistently in these various news conferences. He's also now using them for the purpose of ratings and building his ego. If Dr. Fauci and other experts come to the microphone, we'll take that. But we're not going to play the comments because Donald Trump consistently has lied when he's been at the podium. And we'll also, of course, discuss with our panel his attack yesterday on another black female journalist, this time Yamiche El-Sindor with PBS. Now, folks, as of today, there are 156,818 reported cases of COVID-19 in all of the U.S. and 3 U.S. territories. At least 2,871 patients with the virus have died. That's more than 1,000 people since our show on Friday. 5,220 people have recovered. Now, governors all across the country are doing their best to stop the spread of the coronavirus. New York Governor Andrew Cuomo has been leading the charge and having his daily briefings. And so this is what he had to say today.
The soldiers in this fight are our healthcare professionals. It's the doctors, it's the nurses, it's the people who are working in the hospitals, it's the aides. They are the soldiers who are fighting this battle for us. You know the expression, save our troops, quote unquote. In this battle, the troops are healthcare professionals. Those are the troops who are fighting this battle for us. We need to recruit more healthcare workers. We need to share healthcare professionals within this state and within this country. As governor of New York, I am asking healthcare professionals across the country, if you don't have a healthcare crisis in your community, please come help us in New York now.
Lawmakers and officials all over the country have made businesses shut down to prevent the spread of the coronavirus. But mayors also have been doing their part. Unfortunately, in Mississippi, Governor Tate Reeves issued an order overruling them. We talked about, of course, that last week with Mario King, the mayor of Moss Point, Mississippi. Now, the problem is the numbers are growing in Mississippi. A rapidly growing rate of coronavirus infections has Albany, Georgia under siege. Its main hospital is so overrun with sick and dying patients that nurses at one point have been told to keep working even if they tested positive themselves. In New Orleans, the convention center is being turned into a coronavirus recovery center. In Illinois, Governor Gov Pritzker and health officials announced that known coronavirus cases count have climbed to 461, including 8 more deaths. The first one person who died, African-American woman, her sister over the weekend died from coronavirus as well. A few hours ago, the governor of Maryland, Larry Hogan, issued a shelter in place for that state. Then, of course, you had Ralph Northam, the governor in Virginia, who did the exact same thing as well there. Roy Cooper, North Carolina, also taking action. And so governors have understood what's going on. Now, remember Donald Trump, did this whole announcement how he wanted to have churches open by Easter Sunday. Well, that was stupid. Then they finally listened to the experts. And so now they've pushed everything back to April 30th. Dr. Fauci and others, Dr. Anthony Fauci and others have been saying this is what needs to happen. But what we're also now hearing is that as many as 200,000 Americans could die from the coronavirus. Now, yesterday's news conference, Donald Trump was trying to move the goalposts. Now, all of a sudden, the White House wants to tout that initial report that said as high as 2.2 million people could die from the coronavirus in the U.S. Now they're saying, oh, well, if it's as high as 200, we did a great job. Nice try. We're simply not buying it. Let's go right now to Dr. Suzet McKinney, CEO and Executive Director of the Illinois Medical District, Dr. Leon McDougle, President-elect of the National Medical Association. Glad to have both of you. I want to first start with you, Dr. McKinney. What we're dealing with now is, again, you had Donald Trump playing games with moving these dates around. Governors have said, look, this is nonsense. Now we're seeing more governors ordering shelter in place because until you have far more testing taking place in the country, you cannot get a handle of this coronavirus until that happens.
That's correct. And thank you first and foremost, Roland, for having me on the show today. I really appreciate that. And I also have to give a word with regards to our governor here in Illinois, Governor J.B. Pritzker, and his leadership. And I think what we are seeing with governors across the country is the understanding that you cannot identify an arbitrary date by when we will reopen the country. As Dr. Fauci said a week or so ago, the virus itself will determine the timeline. And so governors are really on the ground in their states, seeing what is happening, seeing how overwhelmed our healthcare system is, and they are stepping up to the plate and exhibiting great leadership and helping the American public understand that Easter is not going to do it. It's going to take a much longer effort before we begin to see a flattening of the curve with COVID-19.
And we also, you've got to do this because, frankly, let's just be clear. Americans have been stupid and idiotic, and I'm just going to say it, let's be honest. The mayor to shut down Lakeshore Drive in Chicago because these people continued to keep walking outdoors in massive groups. They keep congregating. The governor of Florida was pig-headed and not shutting down the beaches. And unless you order this, people are not going to pay attention. That's right. We were all very excited about Mayor Lightfoot's leadership last week when she said, listen, folks, I'm seeing entire 5Ks being run on the lakefront. And so she stepped up and used the full police power here in the city of Chicago to ensure that the lakefront paths were shut down, as well as the public parks and some of the other public walkways. And quite frankly, I think it sent a strong message that this virus is much more serious than what many folks have been taking it. And the only way that we are going to begin to see our peak and then eventually a decrease in the number of cases is if people begin to take the shelter-in-place order seriously. Dr. Leon McDougle, I want to bring you in right now to this conversation in terms of where we're going next. You now hear the officials now saying, hey, keep these things in place until April 30th. This is now another month. And we saw all the games being played by saying, well, we could be Easter Sunday. We could open the economy back up. Please explain to people why we have not gotten a hold, really, of this coronavirus. And now when you hear Dr. Birch and Fauci say we could have as many as 200,000 deaths, that's now real for people.
So thank you, Roland Martin, for inviting me to present to your audience today. I'd first like to extend condolences on behalf of the National Medical Association for those lives that have been lost and those families that are suffering. In regards to these various artificial timelines that have been put forth, it really speaks to a lack of a plan. What is the strategy? Who's in charge? I know I wrote a piece this weekend speaking to from Katrina to coronavirus. What have we learned? And in the wake of Katrina, we saw where there was an initial failure of the federal response. Fast forward to 2019, just as the National Weather Service tracked the impending strike of Hurricane Katrina using satellite imagery, the National Intelligence Agency, Centers for Disease Control, and World Health Organization were tracking the impending strike of novel coronavirus on the United States. So we are behind. Katrina revealed cracks in the levees, and the novel coronavirus has uncovered cracks in our public health infrastructure and national emergency management system. So who's putting forth this plan? That's what we need. We need a plan. We need a strategy. Where is FEMA? Where is Homeland Security? We need leadership at this time.
Dr. McKinney, one of the things that really jumps out when you start looking at what is happening all across the country is that, as you heard Dr. McDougle talk about leadership. Look, you got Donald Trump at the news conference yesterday accusing hospitals of stealing masks. You've got the governor, Cuomo, of New York, who's saying there's a reason why you have to store stuff, because if you see if you see tragedy coming at you, if you see a train rushing at you, you better be prepared and stock up. It doesn't help, Dr. McKinney, in this moment to literally have the person in charge of the federal oversight saying hospitals are just stealing, saying, hey, it's going out the back door. That, to me, has to be crazy for a medical professional. It's got to be driving you crazy.
It is driving me crazy. I have spent the bulk of my career working in public health emergency preparedness. And what I will tell you, Roland, is from the SARS outbreak in 2003 to our concern over avian influenza in 2006 and 7, even to H1N1 in 2009, we have been planning for a major pandemic to occur in this country throughout that entire period that I just referenced. And we have known all that time that if we were to see a major, large-scale outbreak of a pandemic here in the U.S., that we would have a shortage of supplies, primarily masks and ventilators, and that we would also see extreme stress on our healthcare system. And so to Dr. McDougall's point, we need a plan, but these are issues that we've known about for quite some time. Now, what I don't want to do is discount the work that has been done in state and local health departments across the country. However, clear, decisive leadership is needed at every level of government, starting from the top. And if I could say something about the mask situation, what I would want people to understand is that when a healthcare worker has an encounter with a patient and they are wearing a mask, when they are done with that patient, the proper protocol is to remove the mask and discard it. And you get a new mask. And Dr. McKinney,
for a new patient. That's CDC protocol.
Absolutely.
That's CDC protocol. And so for Trump to stand there and say, well, why can't you just put some liquid on it and use it again, and you can use it up to 20 more times? Like what are you doing?
Unfortunately, that just demonstrates a misunderstanding of the way patient care is supposed to be undertaken. It is unfortunate, it is frustrating, and I cannot say enough about the heroic efforts of our healthcare system and all of the providers in our healthcare system across the United States.
Dr. McDougle, I know this is a law enforcement question I'm about to ask, but I do want to just get your thoughts on it from a health standpoint. Anthony, go to my iPad, please. This pastor in Tampa, Rodney Howard Brown, who flouted these coronavirus rules, held a massive church service. He's been arrested. The sheriff there said this is endangering people. Dr. McDougle, can you please, and I talked to some folks over the weekend, can you please speak right now to black pastors who are insisting on holding service, who are insisting by saying God will provide, how they are endangering their own congregation and their congregation's family members and their friends and coworkers by insisting on holding church services in the midst of this international pandemic?
So, very good question, Martin. So what I would say to church leaders and the community as a whole, the church is a vital part of our community. The church will be critical in us surviving these tragedies that are occurring. So you hear the term social distancing. I'd much rather we use the term physical distancing, because we're humans. We still need that connection to our church. So what I would encourage pastors to do is to have that 6 feet of physical distance, utilize streaming, online services, and be cognizant of the danger that's involved with being closer to someone than 6 feet. And so we have the technology. Every Sunday you turn on the television, there are a number of programs out there sharing the word. So, and I know we have some tech savvy members in the congregation. So I would lean on that technology, that connectedness, that social connectedness, and that word is important.
But it's important, but it's better than death. And,
yes.
and the bottom line, Dr. McKinney, look, this thing may be over in 3 months, okay? 4 months. I would rather have a church to go back to than to have a congregation that's extinct. We have seen nursing homes where coronavirus is spread like wildfire. We have seen this in other places. In fact, in South Korea, there was a woman who was patient number 31. They had coronavirus under control. She refused a test. She then goes out to a church, then goes to a buffet. They believe she is personally responsible for infecting 1,000 people. In fact, I was coming in today, and there was a woman who was downstairs in our building talking to the security guard. And I overheard the conversation. We're in the elevator, and she said 4 people at her church have tested positive for coronavirus. There's a pastor in Shreveport, Louisiana, a black pastor, who said, "Oh, this is no big deal." Guess what? He's dead. Died last week because of coronavirus. Mm-hmm.
Yes, unfortunately, I think, again, we have so many members of our community, the African-American community in particular, that are not taking this as seriously as they should. However, one of the things that I do understand is that in the African-American community, we tend to hold on to our faith during times of extreme stress and when we're having a hard time. But if I could say one thing to your listeners, it would be, this is something to take incredibly seriously. It only takes one person to spread this disease. You spread it to one person, and then that person can spread it to another 100 or so people. And to the point that you made about this particular wave of COVID-19 ending in 3 to 4 months, what I would like people to understand from a public health perspective is the behavior of pandemics. They tend to come in waves. So this first wave might end in 3 to 4 months.
Right.
And by the late fall, winter months, we may see another wave of this. So this is not a situation where we can get comfortable and rest on our laurels. And the only way it's going to end sooner rather than later is if we are practicing the physical distancing and doing those things that the officials from CDC and our state and local healthcare partners are advising us to do.
All right, Dr. McDougle, final comment.
So just for clarity's sake, in Ohio, I know in regards to the physical distancing of 6 feet, we also have an order to shelter in. So if you're in a state where you're ordered to shelter in, follow that edict. So I'm not trying to go against that. So I just want to make that clear.
Well, I'm saying even if you live somewhere where there's no shelter in place, have your own shelter in place. I would rather be safe. And let me be real clear. Look, my wife's an ordained minister for more than 20 plus years. You can pray at home. You can have praise and worship at home. You can sit here and go online, but we cannot put people in harm's way gathering in places of 50, 75, 100, or 500 people because they want to have church. I certainly want to thank both of you for joining us.
I agree with